Hi, I'm Dr. Diana Londoño. I'm a board-certified urologist, and today I'm going to talk about one of the most common procedures we do in the office, which is called a cystoscopy. I'm going to talk about why do we do it, and really how to prepare, how it's done, and what you can do before, during, and after during the procedure, and when to call for any more information after your procedure. If you're worried about something, what are the signs or symptoms you should be looking for? So we'll get started and kind of dive deep into what's going to happen. So again, cystoscopy is the most common procedure that is done in urology. And again, it's done in the office. There's no special preparation for it. So you don't have to drink anything or take anything beforehand. You just come as a regular appointment and you do not fast, and you take all your medications you normally take for the procedure and the appointment. So what does cystoscopy mean? Let's just talk about the basics. So cyst means bladder, and oscopy means to basically put a flexible small camera into somewhere. So for the bladder, will be to put this flexible small camera into the bladder. So how is it done? Well, it depends if you are a man or a woman, because the urethra, which is where you pee out of, is a different length. So I like to think about it as a balloon, for example. I think that's the easiest way to think about it. If you have a balloon, and instead of having air, it has water, and that's where the urine or the pee is stored. And then when you want to pee, it comes out of the urethra, which is a short tube for women, and for men it's much longer because it goes through the penis in the middle of it. And once it's filled up enough that you have a sensation to pee, you then will, get out the urine and empty the bladder. So just like this black balloon, you can't see very well inside of it. So even if you do CT scan or ultrasound or MRIs, it's very challenging to look inside your bladder or balloon. So the best way to do it is with this camera that is very small and flexible, and it'll go in through the urethra and into the bladder. And it's going to be filled with saline irrigation or water to fill it up so we can look inside the surface of the bladder and see what's going on inside. It's going to give us a lot of information. So, again, we're going to look inside. We want to see what's going on inside. And for a man or a woman, we're going to go through the urethra, the tube that you pee out of, to see if something there could be also going on that we will, discuss during or after the procedure. So again, to recap, we are going to do it because we need to get more information and look inside the bladder. We cannot do this with other tests like ultrasound, MRI, or CT scan. We don't get enough information. You don't need any special preparation. Again, there's no fluids you have to drink, no prep like a colonoscopy. You don't have to drink anything. And you just come non-fasting, taking all your normal medications. So how is it really done? So usually we want to check a urine sample to make sure there's no signs of infection, because after the procedure, one of the small risks can be infection. So you don't want to have symptoms and make things worse. And also, if there's an infection, the bladder surface can be really irritated, and sometimes it may be challenging to really see, is this just inflammation or something else? So we want to check the urine, and we usually want to check, especially if you're a man, we want to check that you're emptying your bladder well. So usually go to the restroom, you empty your bladder, and with a little ultrasound, we'll check something called a post-void residual. How much is left over after you pee? And this is helpful because another the risk we'll talk about a little later is that you may not be able to empty your bladder or pee after the procedure. So we want to see where you start so we can compare it, and also make sure we don't need to address that as well before we even start. So these are some of the things that your urologist may check before the procedure. So now you're there, they've checked your urine, maybe they check to see that you're emptying, and what's going to happen? Well, you're literally just going to lay on the exam table. They're going to clean the entrance of where the urethra, the urine, passes out of the bladder, with either some iodine or any cleaning solution if you're allergic to iodine. And they're going to clean it, again, to make sure we decrease the risk of infection. If you're a man, they may or may not use some numbing jelly. And a woman, like I said, because the urethra is so short, it doesn't make a lot of sense because it just goes into the bladder and you don't really feel the effect of it. So it's really more usually used in a man, but not always. And after that is done, then we go ahead and put the camera in through the urethra into the bladder. Again, you're going to feel slight discomfort, but it should not be painful. For a man, again, if it's a long urethra, which we know, we're going to go through this sphincter, what controls the urine flowing. So it's important to relax and breathe and not tighten when you're nervous, because if you tighten your body, you tighten your sphincter, and we're going through it. So it's best to breathe and try to relax your body. So as we're going in, we're going to have water running through. So you're going to feel water running through. Then we go through the urethra into the bladder. And again, we're going to fill it up. And then we're going to look all around. So, the risks, we're going to talk about that. So why are we doing this, and what are the risks? The risks are very low. The major risk is infection, that you have an infection afterwards. And that may feel like burning, frequency, urgency, blood, cloudy urine. You could have fever, chills. And the urine is checked and there's bacteria. So that can happen after the cystoscopy. It's rare, but it could. So that's why we're checking the urine. And many times we may give you an antibiotic right before the procedure, depending on your risks of having a higher chance to get an infection. The other risk could be bleeding, especially in a man, because we're going through the longer urethra, through the prostate, which sometimes can be large and can have a lot of circulation, so it could bleed. So that can happen as well. Another risk could be retention, which we talked about before. That means that after the procedure, you may not be able to pee. Usually, again, this is with men or men with larger prostates. It's very rare for a woman to have this. So what could be expected after the procedure? You would expect some mild burning, some mild urgency to pee, and a little blood that should clear with increasing your water intake. If you're having a lot of burning or discomfort, you could always take over-the-counter AZO, or your doctor can give you a prescription of something called Pyridium. It's a medication that can help the pain and will make your urine orange. You don't want to take it more than a couple of days, because you don't want to mask an infection, because that can happen. And that would mean that the symptoms would last longer than a day or two. But you can certainly use it the first day or two after your procedure. So what is not normal? And when should you call your doctor? Again, if you are burning that is lasting more than 48 hours, if you have blood that won't stop when you're peeing, or you have so much blood, clots are forming, and you can't pee, you have to call your doctor. If there's fever or chills with any of these symptoms as well, again, call your doctor right away, let them know what's going on, and they can guide you to see if you have to come back to the office or go to the emergency. So now that we understand, why are we doing it, how to prepare, what are the risks, let's talk a little bit about, what are we really looking for? Why are we asking you to come for this procedure in the office? Well, the reasons can be different if you're a man or a woman, and some may be overlapping, but some may not. So one of the common reasons to look with a camera with a cystoscopy is if there's blood when you pee and there's no infection or a positive culture. So if you have blood in the urine that is never normal, you have to let any doctor know about this, and definitely want to see a urologist. You could also have something called microscopic hematuria. That means you don't see it, but it's under the microscope when they send a urine sample. What's really important about this is that it cannot be diagnosed with something called a dipstick. A dipstick is that little stick that is used in the doctor, the urgent care, or you can even buy them over the counter. And they look for traces of blood. It cannot be diagnosed with this. It really has to be sent out to the lab, and under the microscope, they're going to look for these blood cells. The cutoff is 3 red blood cells per high power field. And if you look at your urine test, it should say RBCs, and then it has a range. If it's less than 3, there's nothing to worry about. If there's trace, there's nothing to worry about. But if there's more than 3, you definitely have to see us. And again, you'll need a cystoscopy and other tests. So that's one of the most common reasons we do cystoscopies, is to look for sources of blood that you see or under the microscope. But we're also looking for causes of pain in the blood or the pubic area. We're trying to figure out why there's a lot of symptoms of frequency or urgency to go. Or if you're having frequent infections in the urine, we want to look for what could be the causes. Also, if bladder cancer is diagnosed, which is seen when you put the camera inside, you see a tumor growing, it's diagnosed and treated, and this is not invading into the muscle, so it's superficial, you'll do routine cystoscopies to make sure cancer has not come back. So if you had superficial bladder cancer that did not go deep into the muscle, then this procedure will be repeated to make sure cancer doesn't come back in the future. So again, we're looking for blood. We're looking for symptoms of frequency or urgency or pain or infections. So what can we really find when we look inside? Well, we're first going to go in through the urethra. So in a man, this can be very helpful because the urethra is a tunnel really that carries the urine from the bladder out to the body, out to the toilet. And sometimes it could be things there like strictures or narrowing, and that can cause the urine to be weak, the urine to, not be emptying as well as you like it. And it can be one of the symptoms and signs or sources of infections as well. So if we, are suspecting that we're going to look, there's no other better really way to look for this because you really have to look with the camera to see this. So in a man, a stricture is something we're looking for, again, that narrowing of the urethra, but we can also be looking for, again, bladder tumors, bladder cancer, which may not be able to be found any other way. We're looking for causes of infections. So in a man or a woman, are you just not emptying well? In a man, is a prostate enlarging causing this? Are there little pockets in the bladder called diverticuli and are storing more urine there and not emptying well? Is there perhaps a fistula? A fistula is an abnormal connection from one organ to the other. For example, in this case would be perhaps the large intestine to the bladder. So there's a connection that should not be there where the intestine and the bladder are connected, maybe because of prior surgeries or radiation or diverticulitis or an abscess where there's pus that formed, and that connection can happen. And that could be a source of recurrent infections that we can't otherwise figure out why. We're also looking for, what does a bladder look like? What is the capacity? Meaning, how much can the bladder hold? And do you get a lot of frequency and urge to go with a small volume? It can help us with, deciding some treatment options. We're also looking for, in a woman, not the strictures or narrowing, but sometimes there also can be diverticulum, those little pouches in the actual urethra. Sometimes it can be seen, not always, the little entrance. So it could be helpful for a woman as well. In a woman, we're not only just looking when we go inside, but we're going to do a good exam to look to see if the bladder has fallen down. That's called prolapse. We're looking for, the overall tissue health, dryness or not in the area on the entrance called the vulva. And if you've had surgery before for leakage, for incontinence, or to lift up the bladder, we're looking to make sure that perhaps there's no sutures or mesh if it was placed that has gone through the vaginal wall into the urethra or the bladder. So we're looking for things that could be causing those symptoms of irritation or frequency, blood or infection, which could be any of these. So another reason why we would do a cystoscopy can be to inject something called Botox. And Botox is popular when people inject it into their face to try to make sure those wrinkles, are not seen as much. But you could actually use it in the bladder as well. And that's going to help decrease the frequency, the urgency, and it's going to allow the bladder to fill a little bit longer so that you don't have to pee so frequently or urgently or leak. So when you inject Botox, it has to be done with a cystoscopy. So a camera will be placed and then the Botox will be injected all throughout the bladder surface to help you. So if somebody or one of your physicians is saying you're going to get Botox, it's going to have that cystoscopy with it. So again, there's many reasons why we are looking inside. It's really important information we get from that. And if your doctor has recommended it, it's because they're looking for something to account for your symptoms, or maybe to, if you're going to have an operation, to plan for the operation as well. And it can give you a lot of guidance, especially if you're a man and you're planning some type of prostate surgery, we can see the size of the prostate. We can see if it's growing into the bladder, and that can help guide us in which type of surgical treatment you may need, because there's many types of surgeries for prostate. And depending on the size or the shape, it may help your physician and you come up with the best solution for that. So again, I hope that this video was helpful on how to prepare for cystoscopy, what to expect, and why are we looking for, for this procedure, what are we looking for? If you like it, please subscribe to the channel and share. And again, keep watching for more informational videos and share with anybody who could benefit.